My name is Felesia Bowen, and I want to be a dean. Let me tell you why. I think in every nurse's life, there is a patient or some situation that stays with us. And for me, that happened when I was a student at Tuskegee University. You see, I was assigned to take care of a little girl. We'll call her Samantha. Samantha was 9 years old, and she'd been in the hospital for a very long time. And my job was to get her ready to go home because she was going to be discharged into the care of her grandmother. So I introduced myself to Samantha, and I asked her to go in the bathroom and brush her teeth, and I'd be in there to help her. I noticed that when she went in the bathroom, she turned the water on, put a cup under, turned the water off, she dipped her little toothbrush in the cup, and she began to brush her teeth. That caught my attention. So when I went in the bathroom, I looked, and I saw that the toilet hadn't been flushed. She's 9 years old. 9-year-olds forget to flush the toilet all the time, right? That meant something to me. I knew Samantha did not have plumbing in her home. How do you know, Bowen? Because the way Samantha brushed her teeth was the way I brushed my teeth when I went to visit my maternal grandparents in rural Alabama. And at night, we had something called a slop jar. And you pee in the slop jar, and in the morning, my grandmother would get it up and take it down by the outhouse and get rid of it. So I went and I told my instructor, this little girl does not have running water in her house. I knew that if I didn't do something, she was going to have a horrible infection. So my instructor came in, talked to Samantha. Long story short, her discharge was canceled for that day. The social worker was able to get her grandmother, housing with plumbing and water and everything that she needed to take care of her. I think about Samantha a lot. I think about health disparities a lot. You know, African Americans, Hispanics, Native Americans, Alaskan Natives, we have the worst health outcomes when compared to white people who live in this country. It's 2022, and with all of our medical advances, with everything we know, we have certain groups of people who are experiencing awful health and dying younger than they should. But we know that when minorities are cared for by people who look like them, speak their language, understand their culture, the health outcomes are much better. Now, what culture did Samantha and I share? Well, we were both African American, but we shared a culture of poverty. She'd been in the hospital for how long, brushing her teeth that way? And no one really thought anything of it. Or they'd just come in and flush the toilet because she's a 9-year-old kid, and that's what kids do sometimes. But because of my lived experience, I knew that she didn't have plumbing in her house. That's what a diverse nursing workforce does. Yet, minorities remain underrepresented in the profession of nursing. Now, if we want to decrease health disparities, and we've been saying this for years, it will mean that we have to be intentional. We have to be intentional in recruiting students and educating them, because some of those students are going to go on to be experts at the bedside. And some of those students are going to go on for advanced clinical degrees, and they are going to be experts in the community, taking care of underrepresented folks. And some of them will go on to be nurse scientists, and those will be folks who use science to develop solutions to help vulnerable populations. Now, at least, can you go back, please? At least that's what I thought when I took my first job as faculty at a well-known institution. But when I was hired, I was one of 3 black faculty there, full-time. That means before I was hired, there were only 2. I was on a tenure track, and so all hyped up about disparities. I had a senior faculty come to me and say, you know, this work that you say is research, which was asthma in underserved children in community settings, it's not research. What are you doing that for? I knew that I needed some help. I was on a tenure line. I was supposed to be doing something, not quite sure what I needed to do, so I had to go outside of my unit for mentors. And I found them, people that I was able to work with in medicine, environmental health, social work, and they taught me how to be a health disparities researcher. So I was doing this for quite a number of years, and one evening, I was having a glass of wine, chilling with my husband, and the phone rang. And I'll never forget this evening. It was someone from our APT committee calling to let me know that I was not going to be recommended for tenure. I was crushed. Now, for those of you who know me, you know I'm not a crier. I'll tell you, my eyes don't malfunction that way. What was I going to do? Because in that moment, I felt worthless. I wasn't angry. I mean, I was hurt. What was I going to do? Who was going to hire me? I felt confused. I was confused because for all this time that I was doing this work, I mean, I had been invited to be a fellow in the Robert Wood Johnson Nurse Faculty Scholars Program. That's huge. I was obtaining funding. I was publishing. I was getting national recognition, speaking internationally, mentoring others. But it wasn't enough. You see, for me, tenure wasn't about having a forever job. For me, tenure meant that my work meant something, that my research meant something. It meant that I was worth investing in. It meant that I was accepted and I was part of the team with my colleagues. My name is Felesia Bowen, and I want to be a dean. But at that time, I didn't think it was ever going to happen. You know, a few weeks later, after this big disappointment, my phone rang, and no, it wasn't the APT committee. It was a recruiter who invited me to apply for a position as a program director at a school down south. Somebody wanted me. I was excited. But that job was 706.6 miles from my front door to the front door of the school, an 11-hour car drive. I had 3 kids. One was in college. I have a son who was a sophomore in high school, and my youngest, little 8th grader, who was going to be a freshman the following year. But this is what I wanted. Was I going to uproot my family for my professional dreams and goals? How was I going to be able to parent my kids or be a wife to my husband if I was 11 hours away by car? The sting of failure and disappointment was so fresh. I didn't want to step out and make another mistake. So I talked to my husband, I talked to my children, and I spoke with my mentors. Many, many, many of my mentors. And my decision came down to this. How long would I have to stay where I was before I would attain the rank of associate professor, increase my salary by about 30%, and have an entree into academic leadership? So I went. But it was the hardest decision I had to make because I left my husband and I had to leave my children in order to advance my career. Mentors are so important for professionals. I don't care how big you get, you need a mentor. Before I went to my new job, I had lunch with one of my mentors. And he said to me, "You know, Felesia, one of the best paybacks after an incredible disappointment is undeniable, fantastic success. So you go." They were right. My mentor was so right, and I'm so happy for that counsel, because guess what? The next year, I was nominated and inducted into the American Academy of Nursing and it was for the work that I had done for my research that wasn't research in underserved children. I was invited to serve on national boards. I have been invited to numerous speaking opportunities, and because of my expertise in health disparities, I was asked to give an interview for the Future of Nursing 2020-2030 podcast. I was doing great, and about 3 years later, the phone rang again. And it was another recruiter asking me to consider my current position, Associate Dean, Inaugural Associate Dean, for Diversity, Equity, and Inclusion at the University of Alabama at Birmingham. So I ran through all those questions again, and I'm at a really good place at UAB. I really am. So, what's the moral of my story? Don't let others define you, your work, or your worth. Don't. Have mentors. If you don't have a mentor or 2 or 3 or 5, go get some. Deb Troutman doesn't remember this probably, but I called her up and I said, "I want you to be my mentor." She was like, "Okay." If you don't ask, people won't know. The path to your future is not going to be a straight one. Sometimes what you want most isn't going to be what you need to get you where you are. So don't be afraid to take advantage of the opportunities that come your way, opportunities that may seem like a crazy risk for some people. Don't be afraid. Go for it. Strive for undeniable, fantastic success in everything you do. And don't forget to mentor others. You had mentors, you be a mentor to others. And I'm saying something to the deans out here. You set the tone of your organization, and actions speak more than words. So if you say you want a diverse nursing workforce, you want a diverse faculty, look around. Because if everybody's looking like you, we're probably not being so intentional. We need to recruit diverse faculty, and when you get them, foster them. Set them up for success. Create an environment that is welcoming, that is inclusive, and makes people feel like they belong so that they'll stay. Do the same thing for your students. Folks, my name is Felesia Bowen, and I will be a dean. Thank you.